having his blessings on us. So today we are going to discuss the Katharine Kolcaba's theory of comfort, and for that, the sharing of this beautiful session with us, we have the most eminent speaker, Dr. Elsa Sanatambi Devi. So without wasting much of the time, let me have the privilege to introduce our today's speaker. Dr. Elsa Sanatambi Devi, Madam is a professor, Department of Medical Surgical Nursing, and she is also the Quality Management Representative in Manipal College of Nursing, Manipal Academy of Higher Education, Manipal. And she is the pillar head of Team Expanding Reach and Internationalization. Dr. Elsa, she is a FAMR Fellow, that is the Foundation of Advancement in Medical Education and Research. She is also the professor, and Madam is a faculty at the FAMR International Institute, Mahe, Manipal. Madam holds PhD degree in nursing. She is also an MBA in Healthcare Services, FAMR Fellowship. Madam has completed PG Diploma in Diabetes Education from World Federation Hope Project and the PG Diploma in Guidance and Counseling and Psychology. She is the recipient of UWS GCRF Fund to develop family and community capacity to provide evidence-informed advanced dementia care and to reduce the risk of dementia-related elder abandonment and abuse in India. She bagged President's Gold Medal as Best Outgoing Student in her MSc Nursing, and also she is a recipient of the Trained Nurses Association of India Scholarship. Madam, she is the coordinator of the first IELTS center in India in collaboration with NHS UK. She is also a fellow observer under USIEF grant for 21st Century Initiative to MGH Boston, USA, that is Massachusetts General Hospital, Boston, United States of America. She is a national level Kabaddi player and represented the state of Manipur. Madam is an author of 3 textbooks. Those are Manipal Manual of Nursing Education in the year 2006, Moroney's Surgery for Nurses in 2008, Advanced Concepts, Psychosocial Aspects of Critically Ill Patients in 2016. Dr. Elsa Madam is a member of many professional organizations and has 60 research publications to her credit. Besides being a freelancer editor, Dr. Elsa is a Toastmaster and a Rotarian. She is a project coordinator for Sanjeevani projects for children with cancer from the year 2007 till 2014 under the Voluntary Service Organization of Mahe, Manipal. Her contribution towards Northeast and FAMR are book on panoramic view on Northeast India, Pride of the Nation in 2018. Madam also has a booklet called Reflection, which is dedicated to FAMR fellows. She conducts skill workshops for community nursing officers of Manipur. Madam conducts workshops for teachers and students of CMC Koirenge, Manipur yearly. Dr. Elsa Sana has organized the first international conference on interprofessional communication framework for healthcare professionals in Manipur in 2018. She has recently conducted a 10-day international live seminar series with international MOU partners on mitigations of COVID-19 pandemic. These are the special mention about Madam. Her motto in life is being nice is the best policy, and Madam holds the future plan to work for the elderly with dementia. So I welcome you, Madam Dr. Elsa Sana, to this workshop. Welcome, ma'am. The platform is all yours. Over to you, ma'am.
Thank you very much, Papuri Pathak Chowdhury, for being so nice and for the beautiful words, and also in moderating my session today. And I also appreciate for inviting me. Dr. Poonam Thakur has been after me, inviting me to speak on the theme on this Kolcaba's comfort theory. And also I thank at the outset the Secretary of National Teachers Association, Dr. Manish Kumar, for having invited me. So real kudos to all the teachers who really took this, opportunity during this COVID time to share your knowledge and also share platform with various nursing faculty across the country, so that our younger generation, the masters, especially the MPhil, and also the final year students of the graduate students will really benefit from understanding what is theory and how theory can be applied. And I also have a sincere request to the youngsters. Or the sky is the limit, and I think we need to have theories generated from India, because India is so unique with variety of cultural traditions and expectations of the people, various caste, culture, religion. And I think young generation need to do your higher education and do your PhD and come out with beautiful theories. We've been studying all foreign theories, but most of them can or may or may not suit completely to the Indian scenario. So I think Indian theories would come up, and it's high time that the younger generation take this forward while doing your PhD. So I'll just share my screen. All able to see my screen?
Yes, yes, ma'am.
Now, coming back to Kolkaba's theory of comfort, and I think we need to learn from reflections. Now, taking back to our young days, I'm sure all of us have gone through this beautiful time, whether I'm the firstborn or the second or the third or the last born. In this generation, we have, the present generation, we hardly have one kid, so all attention is given to the child. So, how much of us do we remember when our mom, carried us on the back for the last time? The comfort that the mother has given, the comfort that both the parents have given, the amount they have cuddled us. As a child, I think we need to understand what we like the most. It was the time when we want to, be cuddled by our parents, to be carried by our moms or the dads, and the way they treated us. So this is one thing we need to reflect. And as a patient, what did you need the most? Some of us have been patients, got sick and admitted to hospital. But during that hospitalization time, what was the one thing that we needed the most? Was it the medicine or the care and the comfort? And when you grow older and when you get sick, what would you seek for? Whether you will seek for love and affection and care, or you will seek for your money and wealth and power. So these are some of the thoughts we need to reflect and see why theory of comfort by Kolkaba is very very reflective, and also it's a thought provoking for every nurse. It's a very simple theory, and we need to learn and understand what is comfort as perceived by patient, and identify comfort interventions for patients, and also discuss the importance of goal to enhance comfort for patients, and also apply this theoretical framework in the real life scenarios. So today I'll also be discussing on how we can apply to patient. It's a very simple theory, but how we actually apply scientifically to patient scenario will be discussed towards the end of these sessions. So a little bit about Katharine, the beautiful name, and Kolkaba. She's just 76 years old by now, and she's working at presently as associate professor in an emeritus at the University of Akron College of Nursing, USA. She has a very humble beginning, and born in Cleveland. She has done her diploma, she has done her BSN, and then did her PhD. And her PhD was in this area of comfort theory, which was awarded in the year 1997. I think she's done a very simple but a very humble job towards patient care contributions. Now, to her, if you look at what is holistic comfort, holistic comfort is the desirable outcome of nursing care in any setting, and moreover, it's an umbrella term. Comfort is umbrella term. It's a huge term where we can have so many aspects. So which where she means that discomforts that the patient may experience when you enter the unit, when you enter the emergency, when you enter the operation theater, when you come out the operation theater, when you're in the ward, with various procedures, with various interventions that we do in the hospital while we care for the patient. So these discomforts are many and may include pain, may have nausea, anxiety issues, and also cold. Because suddenly especially those of us in the hot place, if you suddenly put a patient inside the ICU in the chilling ICU AC, patient may not be comfortable. So we need to understand. We being inside every single day, we are used to the temperature, but it may not be favorable to the patient. And also isolation, which is there, because when you're in ICU, no one can see you, nor anyone can enter, and just the way they care every single day, it's not possible. So that isolation as well as physical problems, psychological problems can actually hamper. So we all understand when a child is being injected, it's the mother who actually cuddles the baby and hugs the baby so that they are diverted and the pain is less. Otherwise, the child, because whatever pain you perceive in childhood is a big memory for the child. That is why every single child refuses to go to the hospital, is not only for the procedure, but the frightening scene that you see and the little pain that they perceive lasts long. So, how comfort theory is best understood? We all define health as complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Now, this states that nurses assess holistically all the patient's concerns, like physical concerns, psychospiritual, socio-cultural, and also environment. So, these comfort needs of the patient in all settings need to be assessed. So nurses implements a variety of intervention for all the physical, psycho-spiritual, psychocultural, socio-cultural, and also environmental needs. And they also measure. How do you measure today? We measure anxiety of the patient using anxiety scale, depression scale, and we also have pain scale if you want to. So we measure patients' discomforts in various settings, and we using various scales and tools, etc., etc. We measure. Now, this part of comfort theory also describes positive and negative intervening patient variables. Now, there will be some variables from the patient which can hinder and cause either a negative intervening, or the patient's experience and variables could be very it may impact positively, and on the other side it may also negatively impact the outcome. So patient variables are like financial situations, cognitive status, extent of social support, and also prognosis of the person. Now, financial situation. For example, a person who cannot afford ICU care for 10 days is very difficult, and we say the patient has gone against medical advice. Gone against the medical advice is not because the patient want to leave the hospital and not take care, but it is because the family members are unable to pay. And if you have an intubated patient who is going home against medical advice, is certainly is dying. We all understand that. Of course, euthanasia is not accepted legally in India, but if you think in the reality, this is the situation. Though this can negatively affect the intervened by the nurse, and also cognitive status, that is understandability of the individual, and the extent of social support, that is family support, relative support. When a patient is admitted nowadays, if you see patient party are who are the patient party? Most of the time they are the paid patient party and not even the family members. Children are almost all away in various cities or even gone abroad. And here there is no one to care for, especially elderly. They are all alone with the helper or the paid caregiver and things like that. So you can imagine the extent of social support that can have negative impact on the care given by the nurse or to be intervened by the nurse, because family member, the thought and the love and affection given by a family member is obviously different when given by a paid caregiver. And also prognosis, if the prognosis is bad and the patient prognosis is bad, and then we're just waiting when the patient is going to die, or when the patient is going to have their end moment, this can affect the intervening variables, what the nurse intervenes or the interventions done by the nurse. So what's happening in the COVID time? It's very alarming for all of us. We are all scared if we catch up infections, because today we are also seeing the hospital scene. My 1 month experience of having to counsel patients, COVID patients in some of the cities, is quite overwhelming, because one of my students who had the COVID positive in Mumbai, he was admitted in the ICU with low saturation, and he had serious lung problem. And he while coming out after 10 to 15 days out from the ICU, his explanation was that it was very alarming for him, because and he was frightened. He said, more than my physical problem, mentally I felt he felt he was tortured, because left and right patients were dying, and the number of healthcare professionals are very few to manage the entire situation. Henceforth, you can see your patient on the left and right and in front are dying, and nothing can be done. Imagine you are surrounded by dead bodies. How would you feel? So these are some of the psychological issues, variables the patient can experience, which can also hamper the intervention led by the nurse. We have three parts in that comfort theory. The first part is comforting interventions. This will come time and again in various slides, so I think you have, all of you need to put inside your brain. So comforting interventions, and also enhance patient comfort positively related to engagement in health seeking behavior. Means if you give a very comforting intervention, that means patient will comply and take health seeking behaviors, or they'll come back to you for help or for any of the healthcare issues. They'll take timely actions, or they comply to the treatment modalities. So when patients and family engages in health seeking behavior, you know that institutions have better outcome. That means if you say that you go to X hospital, you get all right. Because this is the type of name tag that you get, because it is outcome of patient satisfaction. You'll also have a good satisfaction by the staff. So the retention of the nurses are better, and cost of the patient can go down, because when you do regular checkup and patient comply to treatment, they will reduce the number of emergencies. Means sudden emergencies and sudden critical emergencies can be reduced, thereby reducing the cost of the patients. So again, coming back to the three intuitive parts of the theory. So interventions are effective. Result that if your nursing interventions are effective, the results increases the comfort of the patient. So increased comfort of patient result in strengthening of their tasks ahead, that is health seeking behavior. So increased patient engagement means you are sick because they seek healthcare behaviors. It strengthens the institution and adds to quality service. So when quality service is there, integrity of the hospital become better, and of course that is why some of the hospitals in India are tagged as the best hospital. That is how we rate the hospital. It's all based on the patient's feedback. Now, as we rightly said, in Park, we studied health is state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of age, race, religion, political beliefs, economic or social conditions. Now, you are here. All of us are here in good spirit, in soul, mind, and body. And all of us have some of the variables, like to be truthful, stay in harmony within oneself and others, hope against hope, love and affection from family members and the healthcare team, the joy that you show, because unless you have a joy, you can't smile on your face, and the peace, unless you have peace, you can never sleep. So when patient has pain and disturbed emotionally, we cannot find any, and we cannot say that the patient has slept. Patient says, I'm unable to sleep is because he has lost his peace because of the fright and the pain and the agony that the patient is going through. So according to Kolcaba, what is theory comfort means? It's a mid-range theory. Mid-range theory means she has taken a few variables where she studied to intervene. Nursing interventions are being studied, and that's how it's being analyzed and predicted. So humanity, very much, this theory is very much humanistic in nature and is based on patient's needs, completely on the patient's need. Therefore, this theory is a pure nursing care nature theory, and therefore it is very much applicable to our nursing process too. So this theory says that, again it is coming back, there are three fundamental needs of all human beings, that is getting relief maybe from pain, getting at ease while suffering from the particular condition, or transcendence arising from the healthcare situation that are very stressful. Now transcendence is one of the highest level of Maslow's hierarchy of needs, if you remember. So Maslow's hierarchy at the base says your basic needs, and the last one, the one we used to talk about, was self-actualization. But now the new theory of Maslow says transcendence. Transcendent me. For example, if you are a person who is very good in gardening and loves gardening, and your hobby is gardening, when you plant roses in the garden and suddenly one flower comes up morning and it blooms, you really enjoy that. Is not? I'm sure all of you will enjoy seeing the creation of yours. Okay, what you planted, it has grown, it has bloomed. It's very beautiful. Now you also would like someone to express. Transcendent means you're able to bloom yourself, and you're able to enlighten the another person bloom and see they also grow. It's like you do meditation, you know what peace is within you. If you're able to teach another person meditation, and if you're able to make them feel the peace and the serenity inside, I think that is known as transcendence, means you're able to see the another person. So effectiveness intervention leads to enhanced comfort. Engaged patient leading to health-seeking behavior is repeating so that everybody puts into the mind, and positive institutional outcome is increased when people seek health facilities, and also institutional integrity increases, leading to quality services. So why it is important? Because this theory of comfort is important because in the theory it explains about internal factors and the external factors. So carrying attention to one cell that needs it in the form of comfort intervention can enhance total comfort. And when comfort is met in one context, total comfort is enhanced in the remaining context. I'll just give an example. If a patient has, anxiety and headache and so many, when we have stress, we have headache. So if you give nice head massage, the patient not only gets relief from headache, but also total body gets relaxed and you get a good sleep. So when you improve in one context, the whole body may relax, and that is why I said made in one context, total comfort is enhanced in the remaining context. So placing comfort within a framework of or theory provides the nurse to function rationally. It means to say, unless we have a, you see in the unit also, unless you have standards, protocols, policies, it's very difficult to function. But if you have standard protocols and policies and a framework, it's rather easy for a nurse to rationalize and enhance the care comfort facilities for a patient. No, for according to Kolcaba, types of comforts are like relief, ease, and transcendence. Again, it's coming back. So time and again, it'll come back means we are supposed to put right into our brain and not to forget. So relief, ease, and transcendence. Relief means having a particular comfort need being met. Pain, see, you have pain. You have given pain medication, so pain is relieved. Or you have pain and you have given foot massage and it has reduced. Ease that is being calm or content. You are able to with ease, you are able to even bear your pain. With ease, you are able to sleep. Okay, transcendence, a feeling that one can arise above the problem of pain. Even if pain was there, the nurse gave me a very good bath, hot bath, and patient nurse gave me a good body massage, and so you feel very good. Even in your dying bed, you could feel nice that someone is caring for you. So that's being transcendent. So context in which comfort occurs are physical, psycho-spiritual, environmental, and socio-cultural. These are the contexts in which she has tried out her research concept to look at what type of relief they got at being at ease and also transcendence. So this will again repeat, and we'll also see in format in a conceptual framework how we can intervene on the patient. So physical is involving bodily sensations and homeostasis, like if there is a deranged homeostasis. Psycho-spiritual is like self-esteem and self-concept. Self-concept means the overall of what you are is based on your self-esteem as well as self-image. So what you think about yourself and what others think about you is your self-concept. And also sexuality, male, female, a meaning in life for me, and also spirituality, which contributes to internal awareness. Environment here means, suppose when you get admitted to a unit in a hospital, you look at how if you see a dirty wall, it doesn't help you, it doesn't help you feel good. So when you have a nice clean ambience and a right kind of painting in the room, if it is a kid, right kind of things being around the child, that makes them actually heal. It's not only about medicine, but it's also about the environment that helps in healing of an individual. Socio-cultural, that is the interpersonal, family, and societal relationship. And also if people have problem in their finances, if their own community helps, club helps, or any group of people who facilitates some of this. And also teaching, healthcare personnel, etc., may also refer to family traditions, rituals, and religious practices. Here I just give you a story of a death care which I experienced when I was just doing my first year masters. I was posted in neuro ICU. Then there was a patient who came with RTA, very severe head injury, and the patient died. When I entered for duty and took over the patient, within 5-10 minutes, the patient died. So the head nurse was talking to the patient party, and they told me, Elsa, tie the leg. Then I was thinking, what is that tie the leg? And the patient is a Lingayat. It's a one kind of religious group of people. They said, tie the leg. I was thinking, tie the leg means, so I was like puzzled in between because when we prepared, the patient was given bath and they said immediately tie the leg. So I was thinking, because I'm born Hindu and I'm Christian, so my concept of death and dying is like, you beautifully arrange the give birth to the body, to close all the orifices, okay, strap up the jaw, and so that it doesn't look, close the eyes. Everything was my concept, and put into a beautiful coffin, and that's how death and dying means to me. But when they suddenly told me tie the leg, I was thinking either straight leg to be tied from big toe to toe. I was thinking this is a no, in like when you sit in squatting position, tying like that, almost in that folded legs. I was shocked because I was thinking, if you tie the leg of a man who is 90 kgs and big belt, then he'll not fit into the coffin, was my perception. But it was a cultural factor. So they said tie. So they gave me bandages, and we finally tied the person's leg, in a squatting position, like when you sit down for meditation or something, like we have tied up. This was one of the cultural practice which the Lingayas follow. Therefore, as a nurse, I may be a Hindu, I may be a Christian, or I could be belonging to any caste and creed. But it is good that we have awareness about what is my patient's likes and dislikes, what are the cultural practices if they die, and if they have to. So these are things we need to be oriented. That's why I said India is a multicultural country, and therefore theory need to come up very very logistically from the youngsters that are coming up in life and doing PhD. So what are needs to her? Physical needs are like, the patient may have a physiological parameter derangement, so like fluid and electrolyte imbalance, patient has low saturation, patient has pain, nausea, fever, etc. So psycho-spiritual needs are like need for inspiration, get motivated to survive with even the worst disease, being able to grow or rise above, that is transcendence. These comforts, like can be, these comfort interventions could be like giving a nice massage, head massage, leg massage, counseling, touch therapy, and encouraging words to the patient could mean a lot to help their meeting their psycho-spiritual needs of the patient. Socio-cultural needs are this; those are something very sensitive to the cultural practices of that particular group of people, or the body language, and also the way we care. So how one honors cultural tradition, assisting in living paperwork, etc. Nowadays, the remaining people of the family members, fight for the property. When even in the, I have seen in the ICU people coming in and taking fingerprint of the patient, and even without seeing what the patient is like. That shouldn't be happening. But a nurse can definitely see if the patient is serious, and if there is something the patient wants to. Even living will paperwork can also be enhanced and helped, for the patient as well as the family members. So environmental needs includes being, in a calm, quiet environment, very comfortable furniture, nice odor, not a smelling unit, and also safe environment. This is very important for the patient's feeling of security. So less noise, dim lights, allowing uninterrupted sleep. Many a times, because of our procedures, when patient is in deep sleep, we go and check BP, we go and check, touch with the stethoscope. That whole feeling will actually wake up the patient. So if the patient is sleeping, I think we should allow them to sleep, and when they wake up, we need to check, unless it is a very serious condition or patient need to be monitored from time to time. So coming back to the comfort and the total comforts areas that we have already seen, that is physical, psycho-spiritual, socio-cultural, and also environmental in the y-axis, and in the x-axis you have relief, ease, and transcendence. So I'm coming back again and again to the word so that we are comfortable. So when you teach your students, and especially the undergraduates, you should know how to apply a theory. So with the physical relief factors, and what you need is pain, cold, nausea, fatigue. So how you ease them is like giving them little warm blanket if they are feeling cold. If there is nausea, you give maybe MSL is given so that the nausea feeling will be, or naturally, if you want to take care of a patient, in the through diet, maybe you have to add maybe 2 3 drops of lemon, and in what they eat, so that taste can return back. So these are some of the nursing intervention that can ease the physical problem the patient has. Transcendent is patient thinking. That is, I will be comfortable as I approach my end of life. So even at the end of life, the nurses are taking care of me, of my comfort. So he'll be able to say that, okay, I'm going to have a very peaceful death. So this kind of feeling, transcendence feeling, should come within a patient when the patient is even in within the last moment. So psycho-spiritual factors are like comfort factors like fear, anxiety. So patient says, I'm done. I just want to die. Imminent loss of loved ones. Okay. So this is how the patient may feel, and they need to get relief from fear and anxiety. So what do we do to erase it? Ease that fear and anxiety is, you may do an art therapy, ask them to draw, ask them to write down, or you may sit and counsel them, talk to them and counsel them, so that the patient can come up with the best solution of their own. And on the other hand, you have spiritual support from family and healthcare team. Not only family and healthcare team, I have seen in the hospital when spiritual leaders, maybe the priest, comes and visits the patient, that means a lot to the patient. Or sometimes I see family members, because in our hospital we have gods and goddesses all over the hospital, every floor we have. So patients will come and take sindoor, and when they come to the ICU, they'll come with sindoor and they put sindoor on the patient's head. It's a kind of belief that they have, the spiritual, the faith that they have. I think these some of these things can actually make them feel that, we are protected by God, and we are taken care of, and we are in the safe hands of the healthcare professionals. So next is socio-cultural comforts that people look for is family distress, possible financial stress. So we are not financial experts as nurses. Some of you could be. We are not chartered accountants to find out exactly their financial distress, but we know from the expressions that patient has financial issues. You should be able to identify what are the resources available even within the hospital, outside the hospital, various NGOs, various funding agencies, or various facilities given by the government for the particular disease or particular vulnerable groups, if it is available. So that can actually help them relieve their distress. So how do we ease them? Family harmony, calling family members. You can even call up all the family members and discuss what to do, how to pay, what can be done. Okay. Or when he goes back to work, when he goes back to work, he in fact can lower down the stress and anxiety and the distress that he has, because again back to home and work he can earn again. And also in transcendence, there are so many people who are not able to manage themselves at home. So many of them are in the hospice center. I have seen some hospice center, they really give free care to the patient. They also have a counselor who counsels them day and night. So they have a very peaceful death, in fact. They don't want to return back to home. Why? Because the community of hospice care center takes care of them like their own family members, prays for them, takes care of their that is spiritual needs. They are all psychological needs and things like that. So environment, cold room, noisy room, roommates. Sometimes we have issues. So how do we ease? Now warm room, okay, little maybe temperature. You can switch off the AC or switch off the fan. Open only the windows. Calm environment where for patients here to ease all their pain and anxiety. A light music also can be given to the patient, or you can give. Nowadays, everybody has something to watch on their touch screens and things like that. So this could be used as technology also can enhance their uh, factor for easing their pain and anxiety. And the transcendence is reassuring and familiarizing home environment during the dying process. See, if I ask all of you being here in the platform, how many of you would like to die in the hospital? I am sure nobody wants to die in the hospital. I, working as a nurse, I used to tell my other nurses, if I'm sick, don't put me in the ICU, put me in the general ward. At least let me see people and die. Because in the ICU, you have no one to ask, only the healthcare professional, one to running up and down to taking care of critical patients. So you would like to die in the midst of your loved ones, right? This is the dream of every individual. But today the things are changing in Indian scenario also. The children don't live with their parents, and the parents are left alone. Most of them die even without seeing their parents. So this part of the last part of the scene has to be taken care of very 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 homely, because everybody would like to die in the hands in at home, as well as in the midst of their loved ones. Now this is a structure for us to take home. Okay, for students, those of you watching out here, you can have an open platform like this where you put columns and rows, and then find out if through this taxonomy structure, if you take care of a patient with CABG, post-operative care, immediate post-operative care of a patient who has undergone cardiothoracic surgery. Okay, so CA patient has undergone CABG. Now, what are the physical comforts that the patient needs? What they want to get relief from? How will they ease? How will they experience a transcendence? So, in all these four areas of physical, psycho-spiritual, environmental, and socio-cultural can be written down. See, this is exercise for the students to think. You can snapshot and see how you can put, because unless you try in an open space, in a blank, you'll not be able to just practice it by saying what Kolcaba has said. Okay, so you can take any condition, any age group, any health problem you can take and see what can be done. So her conceptual framework of comfort theory says that is we have already it's easy now for you because I have already mentioned time and again. So healthcare needs of patient and family, comforting interventions, what the nurses do, intervening variables, like what are you intervening, either the financial part or whether it is in the cultural part, whichever variables we are taking through. So you are trying to enhance comfort of the patient. So when you enhance comfort of the patient, health seeking behavior of the patient improves. So this can be influenced by other internal behavior, external behaviors. So we will see in the next slide how internal external behaviors internally within the body how it influences, and also externally from outside of the person how it influences, and if at the even at the point of death how peaceful anyone's death could be. So this actually helps in institutional integrity and also the progress of the institution, and that is why we see best practices, best policies available in many of the hospitals where they are doing a fairly very good job. So then how does comfort theory leads to institutional integrity? Last, again, we're just summarizing up. So when patient experiences high level of comfort, they tend to engage in health-seeking behavior. So when health-seeking behavior improves, they are more satisfied with their care. Therefore, high patient satisfaction is equal to better outcome, is equal to institutional integrity. And that is why we rate the best hospitals. That is all through patients' feedback. Okay, so why do nurses need to adopt this theory? Because one is to enhance rationalized patient care. That is what is most needed, holistic care of the patient. Better patient satisfaction is to better nursing care. So when they get satisfied, you know that okay, this technique helps and this is how best it works on the patient or for which kind of patient. So high patient satisfaction is equal to competitive edge in negotiating with employers for financial viability of the institution. So if institution earns more money, then the employees also gets upper grade salary, right? So when we want to improve in all areas patient satisfaction, then satisfaction of the financial viability of the institution, obviously our salary will also increase. Therefore, it serves everybody's purpose in fact. So now coming back to the application in the clinical evidence, take the example of a child who is sick. Okay, so the child has come out of the post-operative room. How are we going to look about? So we have already discussed on healthcare needs of the children. There are so many needs a child will have. And so comforting intervention, what you will do, intervening variables on what you will intervene, and also what type of enhanced comfort the patient experiences, and what is the health seeking behavior, that is internal, external, and also having a peaceful death, and how in institutional integrity and quality increases and the viability increases. So let's look at how post-operative child comfort can be thought about. So we have standard comfort interventions, okay, like comfortable bed of the child. If it is for safety, if it is a small child, we put side rails for the child and the mother being around, positioning them, giving medications. When we go with medication, we don't go with a whole lot of trays and go around with a needle showing the child will run away. So it's a nurse who fully takes care of the child. Okay, need assessment and identification. If the child is getting IV fluid therapy, how well you maintain, the patency and all that. Calm, quiet environment, and on the emotional oriented comfort interventions, we have see every child wants to have mother in their presence. If mother is not there, you can see the anxiety of the child. So mother being there itself is a good emotional support to the child. So active listening, emotional support, hand holding, reassurance is specific to the child. Okay, if it is a small child or adolescent, it is going to matter. So on the other side, we have cognitive and functional oriented comfort care interventions where you look at stereotype functional oriented comfort that we usually do in the ward. Sometimes we take the children into the play therapy area. We put them on a running train. So I have seen where we have pediatric units when children will not eat food. So what we do is we put them on the train. We have a running train in the play therapy unit. So as and when the child comes back one round, they get one mouthful of food. So that is how the child play and the nutrition is taken care of when difficult children because of the painful procedures, because of the disease condition, they are not able to tolerate. So we ask them to draw, we ask them to play bubbles, we ask them to do so many other things which we naturally do in the unit. Okay. So intervening variables are like patient's conditions and diagnosis, and also the cognitive impairment of the child because of the either the disease process or the temperament of the child. So depending on this, when you do all these comforting interventions, you can definitely enhance level of comfort to the child. So this assessment, as we said earlier, we use various tools and techniques to assess. So sometimes we use rating scale, but for children, if it is a very small child, we use all the pictorial form of scales that we use so that child understands better in their pictorial form. If it is a pain scale, also we use the pictorial form, not the numbers. So general comfort questionnaires are there, how do they feel, okay, or use the checklist or the comfort diseases are seen up here. Right now, how do you feel? Some of them may say, oh, very bad. Some may say, oh, sort of. Some may say, I'm good. Some may say, I'm very good. So these are known as comfort disease scale, which a child can see and use. So these are very commonly used. So this can be enhanced by internal behaviors and external behaviors. So internally means all our immune system works on. Okay, external behavior is functional outcome that increases if you take the child out for play. Sometime if you take the child for walking, if you take out the child for uh, eating, while they play or while they walk, only people take the food also and try to maintain their fluid and electrolyte balance. So these are some of the external things that shapes their behavior towards the outcome on the child. Or if the child is very sick and going to undergo a peaceful death, looking for a peaceful death. So these are some of the health seeking things that works out on the individual from either from internal or external. So then when we give this type of intervention, patient here, if it is a small child, satisfaction from the child could be assessed through various ways, but patient's mother being very happy, very satisfied for what we have done for their child is what we look at. And also decreased length of stay, cost of care decreases. Okay, so the more you give a better care, the child gets healed faster, and so they can go home. So less length of stay means less cost on incurred on the patient and the patient party. So this can actually enhance the public health and wellness, and also reduce the impact on the individual as well as in the hospital. So you can see now taxonomy structures of post-operative child comfort care. So all the aspects, four aspects, that is physical, psycho-spiritual, socio-cultural, and environmental. So you can already see what are the relieving factors, what will put them at ease, and also what are the transcendence. So if you just look at one pain, physical like pain, thirst, fever, dehydration. So comforting, that what makes them at ease is comfortable position, application of wet cotton or over the lip to reduce thirst. When you said child is put on NPO, then we start, putting wet cotton swabs, and then wet the lips and things like that, so that they don't get dry mouth. Because if you have dry mouth, you have difficulty in breathing. So maybe you will have to give IV fluids. We have to administer certain medications. So transcendence is motivating the child to tolerate pain by diverting mind using maybe various therapies like what we have mentioned, maybe bubble blowing, maybe playing. Okay, today we have a lot of gadgets, so children can you can be asked to watch nice games and things like that. We can motivate and make them or talk positively to them. Positive talks can be taught to them. So this is how the child feels good. Okay, so in all the areas you can list down this, and then you can apply to the sick child. So comfort care intervention categories, if you look at type of interventions, standard comfort care interventions, like standard things is like making the child safe by putting rails, making the child comfortable by having a comfortable bed. Okay, proper positioning, changing the position if the child is really sick and unable to do by self, or maintaining fluid electoral balance. These are some of the standard interventions. Whereas emotional oriented comfort interventions are parental presence, listening to them, emotional support, positive hand holding, providing reassurance, holding them and walking around. Okay, so cognitive and functional oriented interventions are storytelling. Okay, see, every mother tells a story. I may not be a good storyteller, but I'm sure all mothers out here in this platform, you would have told all stories, even what doesn't even exist also. But some nowadays children are so smart that they say, mom, your story is wrong, so we can't do that. So we try to just amuse them and make them diverted from their pain and agony by telling some beautiful stories. Okay, and play therapies and coloring pictures, and then writing down poems. All these things can be used by as intervention cognitively and also functionally. Now, these are some of the ways you apply integrative approach to comfort care interventions for a child with laparotomy if you are taking a child. So I'll just relieving in the relief we have the other the main areas, that is physical, psycho-spiritual. So and the other side you have sociological, that is relief from the separation anxiety, and also environmental. These are almost same, is repeating what we are looking at. So we'll just look at one line so that you'll understand. If it is socio psychological relief that a child is looking for from suppression anxiety. Now, in this COVID time, if a child is positive, my mother is not allowed to get into the unit and stay with the child. You can imagine how children in the initial part of the COVID pandemic, we have seen one post where the child was inside the glass, kind of bedding, and the father was looking from outside the glass. It was quite terrible for any one of us to feel that mother and child is being separated. Okay, so the goal is the child will experience comfort in the relief sense as evidenced by patient observation and expression. So in this Kolcaba also you can still apply nursing process theory. Okay, nursing process is applicable everywhere. So planning is explain procedure to the child every time you go, because new faces, new nurses would be going to the child will get disoriented. Okay, console the child every time, eliminate environmental stresses. There may be big noise or monitor and things like that, so we need to know when to lower the sound, and all dangerous machines not to be shown up to the child, because child will be stressed out. So implementation, you have n number of them. Okay, nursing care that you give, assign patient, the nurse need to orient, okay, who they are, and comfortable bed, semi-fowler position, maybe extra comfort measures, maybe extra pillows are added to the child, or maybe they may ask for toys, you may give some toys to them. Okay, if there is a wound, how to handle the wound, all these things can be actually implemented. So everything that you implement, okay, the rationale has to be provided there. So at the end, you are seeing if the child had anxiety, what you do and evaluate the anxiety using a scale, maybe, okay, using a Pitoro scale. So whether it is relieved or not, whether the child has stress was relieved or not. Now with stress scales are there already, which can be applied to various age group. If there was an anxiety in the child, how did you decrease it? How much it has reduced on a rating scale? Comfort increase or not? Maybe a yes or no, or in pictorial form can be there. So you can actually define and evaluate at the end of the care, even if it is a child. So any age group, age appropriate tools and techniques to be used when using Kolkaba's theory, even if it is applied to nursing process. So to ease mean often meet by emotional oriented comfort interventions. So if it is physically pain, goal is child will attain state of contentment by comfort care interventions as evidenced by observation and expressions. Now this is a self exercise time for all the viewers. So we have already seen one case wherein planning what you will do if there is a physical problem and you want to ease it. Okay, and what do you do for that, and how will you evaluate? Okay, if it is a psycho spiritual, if you have to listen to the child, what will you do to explain before any procedures in the planning, what will you do? So these are some sort of applications you apply to nursing process, keeping in mind all the components of physical, psycho spiritual, environmental, and also socio-cultural. So in the transcendence, in the last component, you have emotional, cognitive, and functional oriented comfort care. So again, we have the assessment comfort needs are like physical, psycho-spiritual, environmental needs, and socio-cultural needs. So in the physical, rise above pain and distressing symptoms. So child will experience state of transcendence, means the child will not be able to forget his pain, so that because the intervention that you plan, that is motivating the child to express, that is using maybe some like the daisies that we have used before, positive talk to the child to avoid thirst, calm environment, because if the child is very thirsty and you still focus without talking, and unless you divert the mind of the child is going to remember their thirst. Okay, calm environment, familiar environment, drawing, painting, indulging the child in play. Now we need to know what have you implemented, what was the best in that implementation that you have done to the child, and how did you evaluate, and what was the finding. So this is also a self task to be filled up. Okay, same thing like how we have done in the previous page. Now coming back to almost my time is up, so summarizing Kolkaba's theory. Katharine theory of nursing is an excellent way to design and assess the effect of integrative comfort care interventions. When I say integrative, we intertwine nursing practices with understanding of various subjects is important here, because human being is not just one-sided. It is holistic health. If you look at, we need to integrate. It is applicable in all patient care setting, and the patient's level of comfort will increase after the administration of integrative comfort care interventions. And the positive thing about this theory is that all the needs of patients are addressed very holistically. When you look at health, if you define health and if you look at the components in Kolcaba's theory, all aspects of health is being addressed. And the best part is that you can actually intervene a comfort care bundle, like how we have care bundles for ICU. We can also have care bundles for identified health problems, and as per the needs of the patients and interests, we can also give a bundle care to the patient. So when bundle care is given, always we know that as per scientific evidences, care is always better, and the satisfaction of our patient is always better, and we don't leave behind any aspect of the patient care, and holistic approach is being used. So these are few of my references, and if any questions we can take through.
Thank you so much, madam. That was a wonderful deliberation on Catherine Kolcaba's theory. So the participants, if you have any queries, any questions or doubt, you can drop them in the QA box. And resource person, Madam Elsa, will take the questions. If you have any query, so far we have not got any query.
What I slept in this afternoon after post lunch, and you have given me a very difficult. I always get either before lunch or after lunch, because before lunch hungry and the brain gets already dehydrated, and
Yes.
post lunch where serotonin is very high and people tend to sleep. So
That's true, madam, but the way you have deliberated and the topic, it was so interesting. I'm sure all the participants, they have attended it quite like attentively. I'm sure they have immensely benefited. They have learned so many things from you. And thank you so much, madam. So any queries from the participants?
they can unmute and talk if they wish to, because it's the last day, and if they want to express anything, that also is possible.
Okay, I have to ask Manish sir, Farooq sir, can we unmute these participants?
Yes, if anyone want to actively participate, they can raise their hands. So I will unmute the particular person, ma'am.
Okay.
If anyone wants to talk directly, they can raise their hands, or they can type in chat box. I will unmute them.
Okay, fine, ma'am. So participants, if anyone would like to participate, I mean, if you wish to ask something, just raise your hand. Most of the participants are asking for the PPT and PDF format.
Or they can check, there is no problem.
That
And
only
yeah,
I can
recordings
see.
will always be there, right?
Yeah, it's there. And so many compliments are coming. They have really liked your session, madam.
Thank you.
Ma'am, here is something for everybody. So behalf of Nursing Teachers Association, I would like to thank everyone. A very good afternoon to all. As we know that we have bothered you a lot today, because today we were having 3 sessions back to back. From morning we started today actually, ma'am. First session was related to breast care management, 9 a.m. Then second was the theory session from 11. And this one, the last session of our theory series. So we are very much thankful to Elsa ma'am, even Papuri ma'am. I can understand on Sundays it's little bit we used to think to relax somehow, but we made participants to join the sessions and they have joined as well. So first of all, I would like to thank the Almighty God for tremendous blessings, because without thee we could not able to organize such webinar series. As NTA is continuing to provide this educational series in this COVID scenario, so that I must say, not 100%, but at least 50% we can gain something. If we are seeing, we are watching, we will gain something. Next, I would like to, we are thankful to our resource persons, moderators for their genuine acceptance for the webinar and made this series a grand success. As it started from 25th July and today is the last day, and even it was the last session of the theory series. So we are really thankful to our eminent speakers. They have provided their 100% to deliver maximum knowledge to our participants, and I'm pretty sure that everyone has gained a lot. Next, I would like to take the privilege to thank entire team of NTA, all the state branches, presidents, secretaries, treasurers, and all the members of NTA for their true endless efforts for this webinar. As we understand that everyone is working their own institutions, they are having their own responsibilities of their institutions as well. And this is the extra work, I must say, NTA is providing extra work and everyone is putting their efforts to make the things getting done very pretty. We are lucky enough to have the wonderful participants for the series who have attended the series without any complaints. In spite, sometimes we had technical issues, glitches as well. So a big thanks to our participants to display their trust in Nursing Teachers Association. At last but not the least, I would like to extend my deepest thanks to each one who has supported the Nursing Teachers Association directly or indirectly to accomplish its goals. So what next? Today, many of us are thinking we will sleep now because webinar series is over. Finally, our work is done. So it's not like that. Dear all, as we have started the next webinar series on breast care management, and we are done with the first session today, 9 a.m. itself. 2 more sessions are there tomorrow and day after tomorrow. So I would like to wish to see you all in these sessions from 9th August to 11th August. Then after that, from 12th August up to 16th August, we are having the webinar series on childhood developmental theories, which is going to organize by Gujarat State Branch Nursing Teachers Association of India. Now, how to follow Nursing Teachers Association for future updates, future programs or events? You can stay connected. You can visit the website of NTA, that is www.nursingteachersassociation.org. You can like the FB page on Facebook, it is available. You can subscribe the YouTube channel of NTA. You can watch the previous webinars, whatever happened during this COVID section, everything is there. You can view also. You can contact to our NTA team anytime for suggestions and queries. You can contact to Mr. Manish Kumar, General Secretary of NTA. Contact number is provided here. You can talk to me even. Anytime you can drop your mail also. You can drop text also. If you need any queries, if you are having any suggestions to motivate us so that we can, you can guide us also as well. We will improve our works if needed any. There are some screenshots of NTA work during this pandemic. The first one is of the International Nurses Day celebration. On 12th May, we requested to all the institutions to light the candle at 8 p.m. to commemorate Florence Nightingale's birth anniversary. Then we had webinar series where NTI on theories and applications. Then here are some pictures of a nursing research webinar also we have conducted, which was of 7 days webinar session. So at last but not the least, I'm not going to bore you anymore actually. Already we have taken much more of your time. So my heartfelt thank to each one of you. You can contact anytime for further details. Thank you very much, Sana ma'am. In spite of your busy schedule, you provided us the time, and really thankful for your valuable session, and it was very much interactive as well. So that's why our audience so much involved in the session, so they didn't put any query even. So most of the time I used to see they are chatting in the chat box, good morning, good afternoon, madam, like this. But it was really a very nice session it was. And Papori ma'am, thank you so much. You got agree to moderate the session. It was a very well moderated session. Thank you very much, ma'am.
Thank you, Poonam, for all the efforts that you have put. And it was so kind of you to have organized such a beautiful series. I'm sure the students will get enlightened. And I appeal to all the students, get motivated and go beyond the box. Don't be inside the box. So I think you need to look at, because today the nursing fraternity has ample amount of opportunities, and you can always branch out and see. Laterally, you have to think. Don't go only vertically, but go also laterally and think and see what you can take from the opportunities that COVID actually has given. The platform has been just open. I don't think if COVID was, this pandemic was not there, I think Punam, Papuri, we don't see each other, right? We don't see each other. I think pandemic has taught us that, we need to be open, we need to learn together, we need to share, and we need to go ahead together. So I think the dream is to be kept alive for all the youngsters. Come on, all of you, all the youngsters, do your higher education and get your brightest dreams. Dream big. Nothing is harm in dreaming big. So all of you can achieve to whatever you want. If you set the target, yes, you can. Okay, that's there. And keep up your spirit high, very high.
Thank you for
Thank
your
you
genuine
so
words,
much.
ma'am.
Thank you so much, Elsa ma'am, for your inspiring words. I'm sure all our participants, especially those students, they will be quite inspired by your valuable words. And I think we can end the session, Madam Puna.
Yes, ma'am, for sure. Thank you very
Yeah,
much.
thank
Thank you,
you.
So much.
Thank
everyone.
you so
Thank you
much.
so much. Bye bye.